Meeting of the Social Services Committee to order. First order of business is approving previous meeting minutes.
Okay, wait, excuse me, did I miss the roll call? Because I don't remember calling in.
No, you're right. We'll do roll call.
Okay.
I don't have the.
Yeah, Mr. Chair, I can do that for you. If you
Okay,
need me to.
thank you.
Okay, Mr. Fine,
Yes, present.
Mr. Camiso,
Here.
Mr. Bruschi,
Present.
Mr. Cleary, Mr. Cleary, Mr. Efficoro, Miss Lockhart,
Here.
Miss McLaughlin,
Here.
Mr. Purley,
Here.
and Mr. Simpson. Mr. Simpson? Okay, Mr. Chair, we have 6 members present.
Okay, thank you. Okay, so we have a quorum, 6 members present. So let's move forward with item number 1, approving the previous meeting minutes. Can we get a motion to approve?
Motion.
Second.
Mr. Bruschi, second. Ms. McLaughlin, all in favor?
Aye.
Aye.
Aye. Opposed? Passed unanimous. Okay, number 2 on the agenda is TMP. Do I list that? TMP, that's the resolution number? TMP 1650?
That's, Mr. Chair, that's just a placeholder in between our process. So
Okay,
for our purposes, it's just administrative processing.
okay.
Yeah, that's actually a tracking number for us, Mr. Chair, that we just send on to the majority counsel's office, and then they're able to make it a resolution. It's really more for us than for you folks.
Okay, so I'll ignore that number. Authorizing the renewal of an agreement with Schenectady County regarding the provision of preschool evaluation services.
Yes, Mr. Chair, thank you very much. Thanks, members of the committee. So this is our annual contract with Schenectady County. It's a revenue generator. We have some slight capacity in our department to do these evaluations, and it's obviously a shared service, if you will, between the 2 counties.
Question.
Yes.
I don't know. How is that being impacted by the coronavirus, COVID-19, and the fact that we're not having? That this was in-home visits.
Well, this is actually for assessing individuals in terms of if they need any special services. So each county has to assess folks, children, if they're in need of special services. And so in this way, we just help out Schenectady County several years ago. Well, actually, so the preschool services themselves are really more impacted because the kids, aren't in school. And so state ed has allowed services, I guess you could say, but they've limited the in-person, and it's a mixed bag, right? So some folks are saying that the tele services are working just as well. Some folks are saying that their children are regressing and they really want to return back to in-person services. But that's unfortunately, we actually ended up initially, we didn't have authorization to even do teleservices. We were able to convince state ED to allow that. And so that's probably about maybe 2 weeks, maybe a month after the crisis started, we finally got them to relent and allow that to happen. This is just for the assessment of actually getting folks determined if they need the services themselves, the children themselves.
So is it our staff or Schenectady staff?
It's our staff assessing individuals that could potentially need services in Schenectady County.
And again, are they doing this through Zoom or something, or what are they?
Well, right now, yes. Right now, yes.
So do you expect it to have a negative impact on the revenue that you're talking about it generates?
That frankly, it remains to be seen, right? Because it's all very determined on school years. So it will be it all depends on how the state goes here later this summer in terms of the school year. But yes, I mean, the moral of the story is that if there's a delay in school, one would assume there's going to be some sort of delay related to the number of kids that are identified as needing assessment.
Thank you.
Mr. Chairman.
Mr. Bruschi.
Thank you very much. Just to pick up on my colleague's questioning, Mr. McLaughlin, I know that you're not, or you might not be the kind of full point person on this, but I'm kind of curious, as we're measuring the attainment of our preschool and our special ed programs, one, I guess, what are the metrics that we're using here? And two, how do you think that we've been trending, here in the past few years?
So this is an educational achievement. This is special education. This is services for preschool age children who have special needs.
Right.
So this is we don't have any, the county doesn't have any involvement from an educational achievement perspective, but you'll see there's a couple items later on in the agenda that go into the actual services for those children, ages 3 to 5 with special needs that the county can provide.
So what is this evaluation system really monitoring? Is it pre-screening vendors? Is it monitoring how the students perform under these vendors? What exactly is being measured here? This is assessing children if they need those services. Gotcha. Okay, sorry about that. That clears up all my confusion.
So like I said, so a few years ago, Schenectady County lost the ability, eliminated the position. I don't know exactly. The moral of the story is they don't have a evaluation team for children with special needs.
To judge who needs to go in.
Albany County to get that.
Gotcha. Okay, thank you very much.
Okay, are there any other questions from the committee?
No, I'll make a motion.
I'll second.
Motion, Ms. Lockhart, second, Mr. Bruschi, all in favor?
Aye.
Aye.
Opposed? Pass unanimous. And number 3 on the agenda, authorizing agreements between the County of Albany and various public school districts regarding administrative expenses related to the special education itinerant teacher program.
So these are thank you, Mr. Chairman. These are the requisite contracts with the various school districts that allows reimbursement for the services that we provide, all part of all the services that we're talking about right now.
Thank you. Are there any questions from the committee?
Well, I'm just going to make the assumption that all of these programs are going to be there's going to be some sort of adverse impact on these programs. I don't know what I have to review timelines are for these items, and I just think that it just seems like there's going to be some impact to me.
Yes, there will likely be, and I mean, everything's going to be impacted. I think Legislator McLaughlin's point is 100% true. We don't know what that is right now, but I mean, everybody in DCYF and of course in our management and budget office tracking impacts on everything, certainly well beyond just DCYF, that's for sure.
But this amount of money, this $109,000, this is similar to what was used last year. Correct.
Well, they make, yes, I mean, they make that's correct. Yeah, I think it's probably, they're making a judgment based on
last year's
factors, not just last year, probably the last few years, averages and things, anticipated increases over the past couple of years, et cetera. So yes, probably something like that.
Yeah, I guess it says here that they vary from year to year in Albany County.
Yes, exactly.
So this is okay. And in order to receive, okay. All right. Thank you so much.
Thank you.
I'll make a motion, Mr. Chair.
Motion, Ms. Lockhart, is there a second?
Second.
Second, is that Mr. Camiso? All in favor?
Yep. Aye.
Aye.
Opposed? Passed unanimous. Okay, number 4 on the agenda, authorizing preschool education service agreements for children with special needs, ages 3 to 5.
Yes, Mr. Chair. So there's a big spreadsheet in this RLA. Everyone hopefully has in front of them. These are the contracts with the various providers of the preschool services to children. This is the type of service where you actually have somebody with the child in the school in either a special needs class or a blended class. And all of these providers, they're actually certified by the state, so we don't have a choice. We have to contract with them. But this is the list of providers that we are given by the state that we can contract with for these services.
Thank you.
Now, does this money have to, I'm sorry, Mr. Chairman,
Oh, Ms. McLaughlin, please.
does this have to be returned if it's not used, or can it be held over for the following year?
Not sure I understand the question.
I mean, if the funds aren't used because of the situation we're in right now, well, do you anticipate, do the funds have to be returned to the Department of Education?
So it's based on usage, right? So really,
Okay.
it's not like a flat rate. Yeah,
Okay, I got you. Thank you. It's not an upfront and then you use it.
that's correct. Right.
You
That's
use
exactly
it,
right.
you use it as you use it.
Yeah.
Okay, thank you.
Okay. Are there any other questions from the committee? A motion to approve?
Make a motion to approve.
Mr. Camiso, second, Ms. Lockhart, all in favor?
Aye.
Aye.
Opposed? Pass unanimous. Okay, number 5, authorizing the renewal of an agreement with Spotted Zebra Learning Center regarding individualized education programs for children ages 3 to 5.
Yeah, so this is a related but slightly different preschool-related services program. Spotted Zebra is actually the only provider of some of these programs that rises to the level that would require legislative approval. The rest go to CAB. I should have mentioned, because I know that some of the legislators had asked before, but the services they provide are things like speech pathology, physical or occupational therapy, things of that nature. Spotted Zebra is a different provider in the sense that it's not integrated into schools. It's actually they go to the center or have somebody come to them. They provide 30 to 60-minute sessions with the children. It's more of a one-on-one type of therapy to meet their needs. And so, they usually meet with them multiple times of a week. Typically it's a little more of an intensive type therapy, but it's similar. And so this is just a contract with Spotted Zebra that rises to the level of needing legislative authorization.
Thank you.
Also, I'm sorry, I should have mentioned also, just like the previous one, state approved providers, et cetera.
Thank you, Ms. McLaughlin. Are there any questions from the committee? Hearing none, is there a motion to approve?
I'll make a motion to approve.
Ms. Lockhart, second?
Second.
Second.
Okay, 2 seconds. All in favor?
Aye.
Aye.
Opposed? Passed unanimous. Great. So next on the agenda is number 6, authorizing agreements regarding the Healthy Families Home Visiting Program.
Thank you, Mr. Chairman. So this is the contract to accept funding from New York State CFS, Office of Children and Family Services. And then it's also a dual purpose in the sense that it asks the contract with Parsons for assistance with Healthy Families home visiting program through the county.
Thank you, Mr. McLaughlin. Are there any questions from the committee? Okay, hearing none, motion to approve.
Motion.
Mr. Brucey,
Second.
second, Ms. McLaughlin, all in favor?
Aye.
Aye.
Opposed?
Aye.
Passed unanimous. Okay, and the last item on the agenda is number 7, authorizing an agreement with the New York State Office for the Aging regarding coronavirus aid, relief, and economic security act funding.
Yes, Mr. Chair, thank you. Hopefully this is the first of many from many different departments that that we begin receiving, Department for Aging was notified of a pot of money that they would be awarded. It's, as they mentioned in the cover letter, it's pretty general funding, although it's into kind of more specific pots, prevent, prepare for, and respond to the coronavirus. Obviously, prevention is a major aspect of it. And of course, aging has been a major component of the response, especially with regard to providing food to those quarantined and taking care of the significant number of elderly who are obviously strongly discouraged from leaving their homes for obvious reasons, given their vulnerability to the virus, as pretty much every data point suggests. So, they're getting this pot of money. Hopefully, it'll be the first of many. It kind of falls into a few different categories: the caregiver support program, nutritional services. Of course, this is what everybody knows as home delivered meals, congregate meals, but that's obviously not going on right now. So it's mostly home delivered meals and nutrition services and supportive services for folks who have somebody come into the home to help them out.
Thank you. Carolyn, I see your hand is up.
Well, I've raised the question as to why it's not in the elder care committee. And that's going to be addressed, I believe, because I'd like to have this taken up with the elder care committee. And I know that there are others like this coming down the pipe, and with all of the attention being given to the elderly during the coronavirus, I do think an additional place for discussion is the elder care committee. So I spoke with the chairman about this, and I believe we are going to be scheduling an elder care committee to also discuss this and any future legislation such as this, particularly as it relates to the elderly. I requested that it be included on the elder care committee agenda. So those of you, I see a few of you also serve on the elder care committee. So please anticipating a meeting next week. So we're just trying to make sure we meet the notice deadlines. So please anticipate getting something soon within the next 24 hours. Thank you.
Mr. Chairman,
Yes.
Mr. Chairman,
Ms. Walker?
if I can ask Ms. McLaughlin a question on
Sure.
that.
Yes.
Ms. McLaughlin, would you be notifying all the legislators if you have an elder care committee meeting? I'd like to be able to attend. I'm not a member of the committee.
Yeah, because everybody can attend any committee meeting, right? So absolutely.
Right. So you'll notify everybody then, right?
Yes, when the notice will be coming from the normal places, and I will make sure that they send it to everyone.
Okay, thank you.
Thank you for the question.
Thank you. Thank you, Ms. McLaughlin. I think that makes a lot of sense to have an elder care committee meeting to talk about these issues. Are there any other questions from the committee related to this CARES Act funding? Okay, given none, motion to approve.
I'll make a motion.
Motion.
Lockhart, is there a second?
Second.
Mr. Bruschi, all in favor?
Aye.
Aye, opposed? Passed unanimous. Okay, that is the last item on the agenda. So we get a motion to adjourn.
Motion.
Motion.
Bruschi, Mr. Camiso, second, all in favor?
Aye.
Aye.
Opposed? Meeting is adjourned.
Thank you very much.
Thank you.
Good night, everybody. Have a good evening.
You too.